Namaste friends, welcome back to my channel. Today we will be discussing on one of the major change that we may see in the near future or it is already happening. The question being taught across the medical fraternity, not just limited to the medical fraternity, it is happening across all the professions. And we being doctors are also being thought provoked or discussions we see across, will AI replace doctors? That is the question. But this AI means it is actually artificial intelligence, and medical profession basically depends upon the intelligence. That's what has been thought since the beginning of the mankind, or whenever the doctor started practicing. The intelligence part of the doctor was considered to the most central part of treating. So now the artificial intelligence means we are discussing about the intelligence itself. So before going into the will AI replace intelligence, let us try to understand what intelligence itself is. The intelligence, as for the Gardner, he has defined it very simple. He has said capacity to solve a problem. Now, the problem could be very simple or very complex. Like you take a problem, now let us see a bacteria which responding to a chemical stimulus like a thermal stimulus moving away or coming near, making changes happening. It is an evolutionary advantage which is actually solving some problem in its own way. Actually it is intelligence now, because intelligence, when we call it as capacity to solve a problem, this is a problem which is being solved, so bacteria is solving a problem. And in Japan, in Tokyo, the engineers model subways with help of the mold. The mold is basically an organism where it grows across the subway system. Now they modeled it, and subway modeling it, mold grew the shortest pathway to reach the destination. So that's what this was an intelligent move. The mold was happening; it was happening there. Now this is a neuron. It is not dependent on the neurons. What we believe that the brain which is a neuron packed, but this is happening without the carbon-based neurons. Where I'm talking about neurons, it is without the neurons. The intelligence is happening. Now, intelligence in a way, when it is problems to be solved, it is not just to the living beings. Now it can even the non-living beings can solve some problems which could be very simple. So the intelligence is not restricted to living beings. It can be even extended even up to the non-living beings. Now, of course, the humans are taken into the next level. We are taken to the next level, and it appears very far different from the basic intelligence what I am discussing now. But it is an evolution which has happened. Through that, we have achieved this. Now, when it comes to the artificial intelligence, will it is disrupting many technologies, professions, and will it affect the medical profession? The answer to this is not straightforward. Rather, uh, it is the time that happens with across scale of the time we will discuss that the replacement, or how much autonomous the artificial intelligence will be integrated scale that happens will be the sort of a change that we may see in medical profession, rather directly thinking that the AI is going to replace or not replace doctors. So in a way, it is not going to totally replace or replace the doctors. Doctors, they themselves will get adjusted along with AI in their practice. That is going to happen. In fact, it is already happening. We are seeing its effect basically in the fields where the data is the major body of treatment, like pathology, on radiology. We're already seeing the impact of AI in medicine. More impact, in fact. I don't say the rest of the places is not impacting. I'm not talking about what we saw in Star Wars movie. I'm talking about a movie where the robots, they were operating independently of the doctor. There is nothing like that. Robots were doing the job of the surgeon. That is a time scale phenomenon. We are seeing the already AI along with the doctor operating or helping him, or they taking help of the artificial intelligence to operate. That is already a scene. I am talking about something which is far in the future. How far is too much difficult to predict. Most say the impact of the AI in a short period of time, people exaggerate, and over the long period of time, they underestimate. That's what is the most common thought across the we in one society. We are doing that. So to speak about the long-term impact on AI is something which is how autonomous it becomes in practice of medicine. Basically, that is a question now. Now, when AI is getting into the treatment of the patients, the question of legality does come up. Now, the AI is predicting and telling you to do something now, and if something goes wrong, now who is held responsible? Is it the doctor or the AI who created? As of now, it is straightforward. The doctor concerned involved is the responsible for anything goes wrong. That is crystal clear now. Now, when AI is now take in a different angle. AI predicts something and doctor disagrees, or and it goes wrong now. AI had predicted right, doctor probably did a mistake. Now will the doctor be punished here? That is which is the difficult thing to answer, because doctor, according to his own experience, he has taken a judgment. We know that our diseases pattern, we take into consideration, take a judgment, and we treat a patient. It is not a deterministic subject. Medicine practice is not deterministic, it is probabilistic. So we go by probabilities. So the AI predicted, probably with some other data which has been trained upon, because of that it predicted it upon that, and doctor, upon his experience or something, he has taken a different decision, and doctor was wrong in that. Still, doctor can be punished or not. That I'm talking in a reverse way. Actually, if the AI predicted wrong and doctor did it right, that is something different. Nothing is going to happen. AI predicted right and doctor did it wrong. Something does wrong. Still, doctors are held responsible, because now there is one more competitor who is going to tell. That is the one thing. Now, this is the place where the doctor has to reconsider his vision towards AI. Now, should doctors use AI in his practice? I personally believe he should use, because it is trained upon the data. Of course, it is not accurate. It can give a lot of mistakes. I mean, basically, in treating patients, if you're directly using it, there are areas where it is AI is being used. Personally, by me only, I use it personally to basically to generation of discharge summaries, or maybe to patient records, previous records. I can generate a summary of it, and when the patient comes for consultation, I can just see that. For such things, I'm seeing actually. Even then, yeah, my job is to see the actual record. It can summarize and give us and patient records. That's what I am doing in my daily practice with our HIMS, which is I myself is a founder. So nice HMS, which where I do that in my practice. So that's what. But they, we should know that the legal systems do have to change with time, the changing times. Now they have to look into the limitations, or the what limitations and the crystality with which the doctor should be held responsible for things that are going to happen. So because there is when things are being looked upon from the different perspective, it may appear wrong. From one aspect, the same thing could be right. From a different angle, it could be wrong. So the legal system have to evolve and adjust according to the times. So that is a need of the hour. That's what I'm telling. In conclusion, AI will not totally replace doctors in near future. Maybe next 100, 20 years, it is not going to replace doctors. But one thing is definite. AI will become essential tools that we need to use in our daily practice. That is going to happen. Those doctors who are using AI every day in their practice, will find it advantages for their patient care. That is sure, because it can give you many things which you need to processing for a longer time. It can give it in a shorter time. It becomes a very essential tool. That is no doubt about it. But replacing the judgment of the doctors, still, it is not up to that level. We need to take the decision ultimately. You can just use it like an assistant or a colleague at the best. With evolution of time, it is going to improve. It is going to stand with you in your diagnosis process, or maybe even therapeutic process. It will be standing along with you. That is going to happen. So we need to also change with this upcoming technologies. We'll also have to make modifications. That is sure. So with this, we will come. Maybe we can draw a smart conclusion. In short period of time, AI is not going to replace doctors. It will get some autonomous advantages with time, but still the doctor will be the person who will be in charge. That is sure. On the scales of hundreds of years, I don't know really. I don't know. It may become more autonomous. The medical profession may totally have a different dimension and look. Totally things are going to be different. And AI has got a different applications, although happening. That is a different story. So this is the thing up to today. Thank you.